Hi. On this back pain rant podcast, I'd like to talk about synovial cysts in the lumbar spine. Synovial cysts are something that oftentimes needs surgical treatment, and I'd like to talk a little bit about the options of treating that problem. I'm Dr. Tony Mork, orthopedic surgeon, endoscopic spine specialist, and we're listening to this podcast from the back pain rant. So synovial cysts are really an outpouching of a facet joint. So the guiding joints in the back of the spine are the facet joints. They absorb about 20% of the weight-bearing forces and are the stabilizers on the back of the spine, which is, think of the spine like a column. So you've got the column of the vertebrae and the discs, and then on the back, you've got these guiding joints, which help to both support weight, 20% of the body weight, as well as rotation. Limits the rotation as well. So that's why you just don't spin around when you're playing golf and your spine doesn't keep rotating. The facets actually are able to limit some of this rotational forces. As a result, sometimes the forces across the facet joint give rise to arthritic changes in the facet joint. And one of the things that can happen to an arthritic joint, be it a knee, shoulder, wrist, any of the joints, is that there's synovial fluid that can build up inside the joint and under pressure can cause a little cyst. So as the pressure builds up inside the joint, it pushes out the soft tissue of the covering or of the capsule and the synovium or the lining of the joint and creates kind of a little bubble or a little kind of a little ball or bubble, but in any event, it's space occupying in nature, which is always the enemy of the nerves passing close by in a closed kind of a container or canal. So, like I said, the synovial cyst will essentially be a result of an arthritic facet joint, and the location of the cyst oftentimes pushes into the central canal or the spinal canal and can be addressed in a couple different ways. If the pain management people try to get involved here, they sometimes will push a big, large needle into the area and try to drain the cyst. But in my experience, most of the time it will recur. Epidural steroids can sometimes, try to reduce some of the soft tissue swelling in the area of a synovial cyst and maybe buy a little bit of time. But oftentimes they stay persistent. The reason that the cysts don't just go down is there can be a ball valve effect. So whatever little tunnel or channel that the fluid went out, it closes back up so it can't get back in. So the synovial cyst is occurring on the facet joint, which borders the spinal canal. And as the facet joint degenerates, the fluid increases, and the synovial cyst will actually grow into the spinal canal, putting pressure on the nerves inside the spinal canal, which eventually usually ends up in your buttock, legs, or thigh. So endoscopically, you're able to actually just remove a portion of the facet joint when you approach it from the back. And again, all this done as an outpatient. As you enter the portion of the facet joint, the soft tissues of the capsule as well as the bone are removed endoscopically. You're not removing so much of the facet as to cause any instability. It's just a portion of it, and it's usually left open so that there's no type of fluid that can build up anymore. So it's a relatively small procedure performed as an outpatient and without any hardware, no fusion, but really having a recurrence of the synovial cyst, very rare. I've noticed, but I guess it could occur. But I think it's a very successful, easy way to treat synovial cysts of the lumbar spine, which is really a result of arthritis of a facet joint and the fluid buildup, which pushes out into the spinal canal and against the nerves going down to the buttock and legs. Thanks very much for listening to this rant podcast about synovial cysts. I hope that you will subscribe to get other topics we can talk about, and feel free to ask any questions that I might comment on in the future.